All right. Hello, everybody. And thank you for joining us today for a very special presentation of the PNAA and Worldwide Health Staff Solutions, helping nurses achieve excellence. And I'm very proud to have with us today Christine Pabico and Maricon Dans. It is a pleasure to have you with us today to talk about all the things you do with the PNAA. I'm going to stop talking and hand it over to you two and really tell everybody what we're going to be talking about today.
Great. Thank you so much, Tracy. Magandang gabi sa inyong lahat. And for us, it's actually morning. We are so honored and delighted to have been invited by Worldwide Health to present to you today. In addition to working at ANCC, which is what you saw on the slides, Maricon and I both belong to the Philippine Nurses Association of Metro DC, and I am the current president, and she's the secretary. And we are both chairing the Welcome Program for internationally educated nurses that I'm going to be sharing with you today. I want to start out expressing that we are excited to be here for many reasons. First, both of us have been in your shoes. Second, because we have gone through the journey that you're about to embark on and have some great tips to share. And lastly, to let you know that there are resources available once you get to your destination. And it is important for you to know what they are and to take full advantage of the support available. Next slide, please. Yeah, if we can advance to the next slide. There you go. Perfect. And, since the early 1900s and to this day, we know that the Philippines continues to be the leader when it comes to helping fill the demand for professional nurses across the globe. And nurses are excited about the thoughts of being able to come to the US, of course, for greener pasture, for better pay, and overall opportunities for a better life. But we also know that the initial excitement is often overpowered by social isolation, anxiety, loneliness, and even high levels of stress. And I can relate to all of that. I left the Philippines when I was 14, so a little different, than your situation. But, even leaving at that age, I felt all alone, leaving all of my friends, and also being in a surrounding where everyone was a stranger and where I felt very different and had to learn a, completely different culture. And even now, 38 years later, there's still times when I feel like I can't relate to some of the things that my colleagues are talking about only because I didn't grow up here. I consider myself very well acculturated now, but I will never forget my first year, here in the US. I remember how every single day I went to church, at the church nearby our condo to pray. And people laugh now, when I share this story because I tell them that I prayed, one, for God to help me feel comfortable speaking English since I was so conscious with my grammar and accent. And then two, to help me make friends. And I talk so much now, at times it's even hard to shut me up. And I always tell my friends, maybe that's because I'm making up for the few years when I was so quiet because of my insecurities. So you're probably thinking, geez, I attended this webinar to feel better. Now I'm more anxious than ever. Well, I do want to reassure you that the adjustment period is temporary and that the more that we can prepare you or for what to expect, the better outcome you're going to have. Another point that I want to make is that, we hear about America being the land of opportunities, and it is true, but it's up to us to take advantage of those opportunities. Within a year of working as a nurse, I was promoted to a leadership position, and fast forward to today, I have my dream job. I get to travel all around the world to advocate for supportive work environments for nurses like you. And every time I'm on that big stage of the ANCC Magnet and Pathway Conference, I can assure you that I try to stand tall, even though you can't tell I'm only 4'11, because I realize how I've become an inspiration for others. And that nurses in our community see themselves in me whenever I'm on that big stage. So, enough about me. As I mentioned, this webinar really is about you, but I felt it was important for me to share, my story to let you know that, what you can expect when you arrive, Also, what you will go through is normal. And then, second, that there are resources and support available. But then again, I can't emphasize enough that it's up to you to avail those support. And then, third, not to let your insecurities that you will have stop you from being engaged, whether it's in the community or at your work setting. As I mentioned, foreign born nurses undergo through the stages of cultural adaptation. Maricon and I are huge champions, for nurse well being because we do know how that impacts patient outcomes and the way nurses provide care to their patients. Increasing stress, we know, leads to burnout and performance inefficiency. It also leads to higher turnover of nurses or quiet quitting. I'm not sure if you've heard of that term, but that's when nurses might not have the luxury of being able to quit. And that might be your case, right? Because you're under contract. You stay, but you do less. That's what we call quiet quitting, and that's not what we want either. So the more that we can minimize the culture shock for nurses who are arriving here, the better. And that's the reason why PNAMDC put this entire program together that we'll be sharing with you in place. Next slide, please. So what you're seeing here are just some of the components of the program that we put together. The very first one is about identifying needs. And, that's identifying the needs of nurses, that's identifying the needs and the pain points of the employers, that's identifying the needs and the pain points of even the recruitment agencies that are bringing you, to your destination. And, one of the things that, we really wanted to do here is not to make assumptions. Even though Maricon and I might have had, very similar experiences, as I mentioned, that was from more than 30 years ago. And we know that we're living in a very different environment now. So what we've done is actually conduct some focus groups, and we still continue, to have dialogue with all of those parties that I just mentioned. And what we want to identify, are, experiences of the nurses that have moved here recently. And I can tell you that we have learned so much from them already and have even made enhancements to the programs that we have developed based on the feedback they've given us. The second part of the program is the Ate and Kuya, and that's actually what the name of the program is. And that's assigning each of the nurses to a dedicated Ate and Kuya, so they have someone that they can turn to for, guidance, for simple questions, or even, just to ask where things are or to find out where resources are in the area. And then the third part is the education piece. And here, what we're offering is an in-person workshop for the very first one, because we do know how valuable it is, to have that personal connection. And then the next four series is a virtual webinar, which, you can see later on that there's going to be some topics that we've identified, but all of that is very flexible based on what we're hearing from the nurses that are a part of the cohort. And then the fourth part is the community involvement and connection, right? Because in addition to connecting you with the Filipino nurses in your community, we also have heard from the nurses about the biggest, challenges that they're having: housing, transportation, and, all kinds of questions that they're having. So we want to connect you with some local resources. We know that we feel more comfortable, interacting and also working with our own kababayans, so we are going to be personally connecting, the nurses here with some Filipino owned or Filipino managed businesses. And then, the next one is a welcome package. And this is simple welcome package, but we know has been meaningful, to some of the nurses. And these are things that you might need, on the first couple of days when you arrive, when you don't have the means of transportation to go to a grocery store. So that might mean, a rice cooker, a small bag of rice, and some essentials. And then lastly, we do want to increase the pride of the Filipino nurses in the area. And one of the big outcomes for us is to retain them. You know, let's face it, the employers and the employment agencies are investing a lot, and you are also are investing a lot. So we want to make sure that we can retain you, in your destination areas. So one of the things that we're doing as a part of our culmination event, so call it your graduation at the end of this, is a recognition or celebration, if you can call it that, at the Embassy of the Philippines here in DC. And, we have been in great contact with our dear friends and delegates, at the Philippine Embassy, and they are very welcome. They are very happy and excited to welcome all of you here in our area. Next slide, please. So earlier I talked about, being assigned to an ate or a kuya just to manage your expectations. What are their expectations? What are our expectations of them and what is their role? They're there, to be your big sister and your big brother as you arrive here. And we want to make sure that you feel welcomed, when you arrive. So this might mean, this is optional. We're not telling them that, they have to do this, but we do have a pool already of several ates and kuyas who said that if they're available and someone is arriving at the airport, that they're more than welcome, to be there and support you. We also, are asking them to connect with you on a regular basis. So that might be every 2 weeks, that might be every week, depending on what you need. That's something that you're going to be negotiating with them, just to make sure that you're okay as you get adjusted. And then finally, we do want to make sure that you attend our PNA MDC events, because that's a part of getting embraced in the community. But we also know that one of the biggest hesitations usually is people saying, well, but I don't know anyone there and I don't want to feel uncomfortable. So now all of a sudden you have a buddy, that's going to be there with you in those events. And then some of the things that we've heard, as I mentioned, we've done some focus groups. One of the things that we already heard from nurses, when we're trying to pair you with an ate or a kuya, that these are some requests. We can't always guarantee, but we will make it a point, to take these considerations when we're doing the pairing. They said that they want someone, who might be from the same area in the Philippines, so they speak the same dialect. They said, they prefer it if, someone is assigned to them who lives pretty close by. That way, if they have an urgent need, they can easily reach out to them. And then one of the things that surprised us, because we always made assumptions, and this is what I love about focus groups, we always made the assumption that, if they're a younger nurse, they probably would want to be paired with a younger nurse that's the same age. And they actually said, no, we want to be paired with someone who is a lot more experienced than we are, that can truly be an ate to us. Next slide, please. And then earlier I talked about the education piece, right? And as you can see, the title of the education series is Gabay Patungo sa Tagumpay, which, just translates to us guiding you to success. And that's exactly, what we're hoping to do with the different education programs that we have in place. As I already mentioned, the first one is going to be in person. As you can see, those are the topics that we're going to be discussing. And then the next four are going to be virtual webinars. We do know how busy you are, and we want to acknowledge that as well. So we are making it as easy as possible, and we are working with the hospitals as well to make sure that they can support you in attending these. So hopefully when you request for a day off to attend an event, that they'll be more than happy to support that. Next slide, please. So, that is, earlier I talked about, connecting you with the Filipino community, right? One of the things that we have also developed is a directory of all of the Filipino owned and managed businesses in the area. So, this could be where the grocery stores are, where the Filipino restaurants are. And, the great thing is, as we have been reaching out, to the businesses, because some of them have chosen to put an ad in this directory, that we're also asking them if they can, have some special deals that they can offer to nurses. And as you can see there in the blue, some of the restaurants like Purple Patch is offering 10%, for nurses, that are going to be visiting their establishment. Next slide, please. So that is just, a summary, right? Or, an overview of the program that we're putting together for you. Now I want to switch gears a bit because, part of managing your expectation is also helping you understand, what to expect when you come here. I don't want to say that everything is a bed of roses. Sure, you come here to the US, everything is going to be fine. There has been some challenges as well that, we have been involved in. But I can tell you, in listening to those, situations, majority of the times, not that it can be fully, prevented, but I think it could have been mitigated if we were able to provide more information before you even get here. So, just as an example of that is, staffing, right? I just want you to know, that the different types of care settings, do dictate the different roles that nurses play, and also the staffing, in those different care settings. So, my take home message here for you is to make sure that you're getting to know your contracted unit before you come here. Make sure that you empower yourself and really, look up. What to expect about those units, because sometimes when people are coming here, as I said, they're looking forward to just coming to the US, and they're very, they have that tunnel vision, and all they can see is, coming here and not really preparing themselves, for what's ahead. Next slide, please. So just a quick example of, what I'm talking about. And, I'm going to go very briefly here. I'm not going to go through all the details in the slides, because I know this is something that my colleague Maricon is going to be talking about. A lot of the challenges that we've heard, or the shock, as you might say, we talk about the culture shock, are nurses that are assigned to nursing homes, and oftentimes, or long-term care facilities. And oftentimes we hear the word, unsafe environment, and I just, want to let you know and manage your expectations, because I know that, this is something that we don't have a lot of in the Philippines, right? Long-term care facilities is not something that's very common there. And, if you're so used to working in a clinical care setting, in an acute care setting where you have, perhaps, six patients, to what, I mean, yeah, six patients to one nurse, it could be a shock when you come to a long-term care where you are assigned 30 patients. But, you have to understand that long-term care, especially those residential facilities, that is considered their home. So the needs of the patients, in those care settings, in fact, they're called residents and not patients, are very different than if you are working in a acute care setting. And also, just know that it's important for you to know this, because just because you work in an ER in the Philippines doesn't mean that you're going to be guaranteed to work in the exact same care setting when you come here to the US, or any place where you're assigned to. So, with that, I'm going to turn it over to Maricon. And I also just want to share that, the welcome program that we have created has now been identified as a national template, which means that, every chapter of PNAA, have been given this information, and they are hoping to develop, something similar in their own states. Maricon?
Next slide, please. Good evening, everyone. It's good morning for us. My name is Maricon Dance, and this is my story. This is me when I was 5 years old. And, as Filipinos, we really have that passion to care, right? And so I naturally gravitated towards being a nurse. And it's really not because I have a lot of healthcare. I would say my family's in the healthcare business, but it really stems from the passion to serve others. And as Filipino nurses, that is really how we are wired, right? Next slide, please. So I graduated from my bachelor's degree in nursing in 1998. And this is my family on the top. My two other siblings were cut off. So sorry. If you see the one on the right, that's our youngest brother. And one particular day, and I remember so vividly, he ran toward me and said, I was coming back from work that day, and he said, Ate, wala na tay pagkaon. For those of you who do not know Bisaya, that means elder sister, we do not have food anymore. So that really was so heartbreaking for me. And it does still, remembering those times. So it was a pivotal moment in my life that I said never again. So why did that happen? Because my family, my dad's business went bankrupt. And at that point, we were really struggling. And luckily for us, fortunately for us, we had a lot of relatives who know about our struggles and are always there to help out. So I said never again. So immediately the day after, I scrambled and looked for job opportunities outside the Philippines. Now, why is that? Well, you all know, as a Filipino nurse, it was really hard to find jobs in the Philippines. When I was working as a nurse in one of the remote hospitals in Cebu, that's where I was born and raised. Yes, I was only earning 4,000 pesos, and I would often tell my colleagues here in the U.S. I was paid at least around $90 per month, right? So the job opportunities there really, it was so competitive to even find a nursing job. Now, I do know right now that the most viable job opportunity for nurses are the call centers, right? But I've heard that the minimum eligibility or requirement for those agents have gone to like a high school graduate. So it's even more competitive, as you can tell. And of course, we already know that our country sadly belongs to the third world, right? It's a third world country. And so there's not a lot of opportunities for our families, for our kids, and the culture, the Filipino culture of parents and families expecting us to give back. So this was me at the fresh age of 25. I was grinning so happily because in my mind, now I can finally support my family. So I went and flew thousands of miles away to the United Kingdom in a remote island near France, but only near France, not France. It was part of still the British Empire. It's called the Channel Islands. It's called Guernsey and Jersey, and there they only have around 59,000 people. Imagine that. I flew thousands of miles away, leaving the island. You guys know, right? Cebu has the best beaches in the world. If I had a choice, I would just bask in the sun and enjoy the beaches, but no. I had to leave my family. I had to get uprooted and leave without knowing anybody. So can you imagine my anxiety? It was nerve-wracking, yes. But then let me tell you more about my story. Next slide, please. Next. Okay. So back in 2004, I was so excited. I finally got my visa to come to the US. Now, luckily enough, my family was also granted the visa. So that explains why I went to Kentucky, because they went to Kentucky. I get asked all the time, they say, why Kentucky? Well, a lot of people don't even know exactly where Kentucky is, except for Kentucky Fried Chicken, right? But then during that time, it was in the early 2000s, it was a little bit different because Kentucky is it's like in the southern part of the US, and there's not a lot of colored people there. So I went there one time. I had a really frail elderly patient. She was Caucasian, and God bless her heart. She said, "I do not want you to be my nurse." And I said, "Well, ma'am, I'm gonna take good care of you," and really tried to appease her. And she was like, "No, I don't want you to be my nurse." And so I felt so, I'm like, oh my gosh, I was so taken aback. And she said, "Call your charge nurse." And I said, "Well, I'm sorry, ma'am. I'm also the charge nurse." So she was stuck with me all night, whether she liked it or not, but that's a different story. So let me just tell you about a few data that we have gathered. And this is really from year 2022. CGFNS, you all know that, right? Because we all take a battle of exams, and CGFNS is really integral to our migration. They receive over 17,000 visa screen applications from 116 countries, a 44% increase from 2021 and a 109% increase from 2018. So imagine that. And out of that, healthcare workers from the Philippines comprise 60% of those applications. Now, we already know that the Philippines is the largest provider of nurses around the world. And the top US states where nurse migrations actually happen is here in Texas, Illinois, Florida, Montana, and Maryland. And that's where I am currently. Next slide, please. Is someone? Thank you. So as you can tell, basing on my story earlier, there's really a lot of challenges that can bombard you left and right. And like Dr. Christine Pabico said earlier, I don't want to scare you, but we just need to make sure that we also are well equipped and we really understand that those are normal things that could happen in your very first few years. So there's this variation in healthcare systems. We already know that, right? Philippines is medically driven. The US, it's absolutely not. And so there's also that language barrier. We all did not wake up and started speaking English, right? Well, I know you can probably tell my accent is still so strong. I have been here in the US for more than 20 years, and I often laugh because I still think in our language, in our dialect, Cebuano actually. And I tell my colleagues that pray for me that everything comes out will be in English because sometimes when emotions are high, some Bisaya do slide. So anyway, there's also those difference in the knowledge of medical terms. Well, for example, when I first came here, I was like, isn't that called amoxiclav? But anyway, so you really have to be cognizant that there's a lot of things that you need to learn, and that's normal. I am here and you will be able to learn too. So, having said that, like Christine mentioned, it's just part of the journey, and eventually you will be able to surpass that too. There's, of course, technology. Oh my gosh, when I first came to the Western countries, United Kingdom, and here in the US, that was the first time I ever got to touch an IV pump. And of course, there's skills competency. There are skills that we were so dependent with our medical interns and doctors, but in here, the nurses do them themselves. Next slide, please. So there's differences in healthcare structure. I could not stress enough the language barrier. When I first went to Kentucky and I had a patient, and so the patient called me and ran towards the room and asked her what she needed, and she said, I want Dr. Pepper. And guess what I did? I ran to the nursing station and looked for the medical directory, hoping to find Dr. Pepper's phone number. And you guys should know it's a drink, it's not an actual person. And also, the one time as well when I had a urologist who asked me for a jelly that was 5 in the morning. And as kids, we have those different flavors of jellies. It was 5 in the morning, so I gave him a jello, and he said, seriously? I said, yes, seriously. Well, apparently he needed KY jelly, and they call it jelly here. So anyway, those are some of the things that sometimes you just have to laugh at yourself and to not take it personally, because those are our learning opportunities. So just take it easy and just laugh at yourself and don't be embarrassed, and they will give yourself grace too, and they will give you grace. And so, healthcare structure in the Philippines, it's so medically driven. We have a lot of help. We have families and significant others who stay with the patients 24 hours, who are even willing to go above and beyond. They give our patients a bath. They help with medication administration. Well, you do not see that a lot in here in the US, although sometimes you do, but you pretty much do the holistic care for your patients along with your nursing assistants and also other interprofessional interprofessional people in your healthcare team. So also in the Philippines, we have paper charting. There might some who are starting electronic medical records now, but in here in the US, it's huge. So around in the 2000s, there was a huge flooding here in the US, and so the medical charts, the paper charts, they were lost because of the flooding. So back then, President Obama actually commissioned healthcare organizations to transition to electronic medical record for that reason. And he also wanted to make sure it was his goal that all electronic medical records are transferable from one hospital to another. So but fast forward, that is where we are currently right now. A lot of hospitals have transitioned to electronic medical records, and also there's a lot that you need to figure out about doctor's orders. There's a lot of standing orders, which I'm gonna go over in the next few slides. Next slides, please. So I've spoken about technology. There's a lot that you need to know. Even the beds, they have a lot of buttons. Lord, when I first arrived, I'm like, which one is which? So you kind of just have to give yourself grace, and it's really just a learning. It would be a steep learning curve for the first few years, but after that, with all your support, like Dr. Christine Pabico mentioned earlier, you will be fine. So just take a deep breath and just enjoy your ride, and you will learn a lot. Medicine, we've already spoken about that. I do know that Liz from Worldwide said, you guys, if you want to avail of other resources, other webinars, she will be offering a few episodes, really honing on those kinds of things. Next slide, please. Okay, so this is the main topic for my presentation is really comparing what it is working as a USRN versus working in the Philippines. So the various entry levels here in the US, you will meet associate's degree nurses, who we call as RNs, and then there is the licensed practical nurses, and of course the bachelors, which are us, right? In the Philippines, there's only bachelor's degree in nursing, which is our entry level. So in here in the US, there are certain states that allow their LPNs to do a whole lot, but majority of the states call for the RNs to do the first assessment, history and physical assessment of the patients when they get admitted to the hospital. And they also do not allow their LPNs to hang bloods, to push IV meds. So it would be your responsibility as RNs to do that for them. And here in the US, the nursing profession has been elevated and is considered the most trusted profession for 22 years now. So as you can imagine, it's really a profession that is very well recognized. I know in the Philippines, we do need to emphasize and work more on the partnership between the nurse and the physicians. In the Philippines, I've mentioned this already, the families are very well involved, and we've talked about the electronic medical records. The nurses here in the US too are actually very empowered and autonomous. It's the culture of shared governance and shared decision making. And really, a lot of organizations have really integrated that into their practice because, as you know, the nurses, we are the ones who spend a lot of time with our patients compared to other professions. So we are the ones naturally who advocate for the patients more, and so they think that we know our patients better. So that said, we're always involved as nurses in major decision making processes, in organizational initiatives, and the physicians also rely on us for a lot of things. And there's a really great partnership between the physicians and the nurses here in the US. Next slide, please. So we've spoken about shared decision making, and there may be standing orders here in the US. You get like standing orders and titration orders for your IV drips. In the Philippines, it's rarely. So I feel like it is really exciting to work here, and I'm sure you will be able to feel it as well because you get to use the things that you studied in school for. You're able to use your critical thinking skills, you're able to use your clinical judgment, and also here in the US, confidentiality is really huge. No more Marites, Marisol, and all that, right? You will get in trouble if you really are like, oh, so and so or your friend was admitted. Let me check her chart. You cannot do that here. You will really get fired if you do that. There's also like patient's bill of rights, meaning if the patient says no more to any treatment, everybody respects that. In the Philippines, I know families often interfere and say, no, we need to do this, we need to do that. But in here, it's really patient centric. Patient satisfaction is huge, meaning that they measure how happy the patients are for your care, for the care provided by the entire hospital, because it's tied with reimbursements. We are also able to do several procedures in here independently. We do not rely on our medical interns to insert folic acids or IVs. I know right now you probably are doing that a lot too, but in the past, during my time, we were really solely relying on them. There's also like simple procedures that nurses are allowed to do, and we're really able to practice at the top of our profession. So next slide, please. In the US, you will see a lot of 12-hour workday. I know in the Philippines, it's mostly 8, except for specialty areas, they have other types of scheduling. What I've heard is that you also have vacation leave in there for like in St. Luke's, I'm coding because that's what I heard last time. They have 10 days vacation leave for the first year. Here in the US, you can accrue your hours up to 14 days for your first year. And then it's kind of the same. You accrue hours just like in the Philippines. So sick time, you also get, it depends on the organization, but like 10 days a year. And they do count your sick time. I mean the number of times that you were able you utilize your sick days. Scheduling here is more on like flexible. It's flexible scheduling. I know you kind of do the same in the Philippines too. And hospitals in here rely heavily on federal reimbursements. So there's a lot of charting regulations that you need to abide by and internal policies within your organizations that you need to be cognizant of. Now, what I really enjoy here in the US is the opportunity to advance your career. And like Dr. Christine Pabico mentioned earlier, you can really dream big. You will be able to, whatever skills or passion you have, you can say, for example, you can venture being an informatics nurse, you can venture being a nurse researcher, scientist, and all that. And the good thing here is that if you really are passionate about it, and then you can submit it as a something for your professional development with your HR. You can talk to the human resources department. They would have professional development fees and school reimbursement. So you can do a whole lot here. There's a lot of opportunities. And work-life harmony is also so huge here. As a matter of fact, there were several meetings that just happened a few weeks or last week and a few days ago, and it was really about advocating for well-being. It's well-being for the entire healthcare workforce because they have, as you know, with COVID, it was naturally amplified. The more we foster the well-being of the nurses, the more they're happy. And, you know, the happier nurses really make happier patients, right? So that's common sense, but it is huge here in the US. And so there's a lot of professional agencies that you will hear about. They're advocating for nurses' work environment, and even for our program that we are part of. It's called the Pathway to Excellence program, and our mission is to build a global community of healthcare organizations that are committed for nursing workplace excellence. Next slide, please. All right. So before I close my presentation, I wanna now let me just full disclosure. This is just my perspective. I know all of us have gone through different paths in our lives. Some have gone through other, I would say, other interests. There's a lot of Filipino nurses here who are already so well achieved. We've had a lot of board of directors, even in the NCLEX, the NCSBN that actually developed the NCLEX exams. There's also a lot of board of directors, Filipino nurses who have been part of their state boards of nursing. Dr. Christine Pabico is also a well-known Filipino nurse, and you heard her. She travels around the world. There's a lot of nurse scientists, so there's really a lot of opportunities. And it's America, right? It's our American dream, and so I just want to caution us to, it's not a bed of roses at all. You know, this is the US. Yes, if you work hard, you will really reap what's due of you. But we all need to be cognizant that in the first few years, it really takes a lot of adjustment. For those of you who might be stemming from other countries, you all know that, right? Because you have undergone that before. You may not experience quite the same experience as those who are coming straight from the Philippines, but it's really a not an easy feat, but it's a fulfilling journey. It's a meaningful journey. The struggle is real. There's the differences in the weather conditions. So if you're arriving here, as you know, the song winter, spring, summer, fall, those are exactly the seasons here. If you're in more on the northern part, you get to appreciate it a lot. It's almost springtime here in DC, and you get to see the cherry blossoms. You really get to appreciate the beauty that God has created for all of us. During the winter, all you'll see the trees with no leaves, because in the fall the leaves fall, and so then it is so sad, and right, the trees don't have leaves, you don't see a lot of greens. But come winter, everything starts to bloom, and you hear the birds singing and all that, and it is such a beautiful, I would say, work of God. So another thing that we need to consider is, if you're arriving here in the winter, make sure you have at least one coat when you travel from the Philippines. And then, of course, there's this food. Okay, that's a major thing, because we always love rice. And to me, my colleagues know that, to me, rice is the life. So I always try to eat rice every day. So don't fret. There's a lot of rice here. There is rice in supermarkets like Walmart and all that. But if you live in the remote areas, you might have to drive a little bit more. And also in big cities, there's a lot of Asian stores now and Filipino restaurants here in the DMV area, DC, Maryland, Virginia. We have several. We even have Jollibee now and Red Ribbon. I have funny stories to tell, but I know we don't have time for that. There's also a lot of community here. PNAMDC, the Metro DC, for example, is a great opportunity to feel like you have some coping family that you can reach out to and all that. So humility. Why did I put it in here? Because we need to be cognizant that we do not know everything. So what am I trying to say? When you don't understand something, make sure that you do not pretend that you know or you understood. They would rather appreciate it if you tell them, excuse me, can you please repeat that? Or I am not understanding what you're saying. They would rather have that than us trying to I mean, yes, us trying to compare the practice with what we were used to. For example, if we stem from Saudi or United Kingdom, if we say, well, that's not what we do there, it's kind of rude sometimes and it rubs them off differently. So we need to be humble that we are trying to assimilate ourselves here, right? And so we do not know everything. It's a new culture, there's a lot of learning curves. So we just have to be transparent and honest. And also working hard, I put it in here because if you truly work hard and you're so dedicated and committed, your supervisors will notice it and you get commended and so on and so forth. You will get recognized and a lot of other things. And in here, diversity, equity, inclusion, and belongingness and justice is also huge. So you would see the intentionality in a lot of organizations to make sure that they have a diverse workforce, and that's why I really love here in the U.S. is because they're very, very purposeful in making sure that all our voices do count. Family structure. Oh my gosh, I cannot stress this enough. In here, you don't have a manong driver, you do not have a yaya, you do not have a cook. What does that mean? You will need to have a partnership with your husband. It's not that I'm the husband and our our culture of only the wives do all the chores, right? As a matter of fact, I guess I was so blessed. My husband puts gas in my car. I haven't put gas in my car for the past. I calculated it because we were married for 16 years. I said 6,000 plus days. I've only put gas in my car twice. So it's really a partnership because I do a lot of cooking. I always try to brag, and also he does the laundry, so we're pretty much compensating and really trying to complement with each other and trying to make sure that we keep our family afloat because it gets so busy. If you have kids, you have ballet, you're a taxi driver and all that. So I really do recommend that you try and really accept and make sure that that expectation you can discuss with your husband ahead of time, because I can let you know several families, Filipino families, have been, I would say, broken for reasons that it's a disillusionment when they came here. They had culture shock and all that. So I just want to caution us about that. Communication, there's a lot of things. If I had time, I would be able to tell you, but in here, the my colleagues, I've learned in the past, because you know how Filipinos do not have filters sometimes, and we say, oh, are you pregnant? Oh, when do you get married? Oh, and things like that. And they really do not appreciate that. They do not even want to talk about how much people make. And also, like, you know how in the Philippines we say, oh, tumataba ka yata. That's a no-no here, which means, oh, you're getting fat. That is extremely rude here. So, I mean, things like that that we probably do not think about, but there's a lot of things that we need to be cognizant. This is not our world anymore. So many people would want to be in your shoes, right? So many people would die to be in your shoes. This is our American dream. So we are in this new world. We are in a new place. We should be not proud enough to not try our very best and not to be. We have to be humble and really try to adjust to the environment and not asking the environment to adjust to us. So that said, I know we don't have ample time, but once again, my name is Maricon Dance, and that's my story. Thank you so much.
Hi, and thank you so much to both Maricon and Christine. What great information. Thank you so much for sharing with our group today. Um, I wanted to just ask a couple of questions, and you mentioned some of these as we went through, but just to close us out, would you each share with us, like, I think maybe two things. One, what is the best advice that you have for someone right now who is in process to become a USRN? And then two, what was the most surprising thing to you in the U.S.?
I would let Christine Pabico talk first. She came here when she was 14. I came here when I was
Yeah.
29. So
Well, I think one of the things that I would recommend is to and I love what you're doing today, right? Because you're preparing people and even trying to connect them with resources even before they leave, because I think, that's going to be the best way to set them up for success. So, there are a lot of people who are so willing to embrace, the Filipinos. So, I would recommend for them to connect, with someone that they know. And even if it's people that they don't know, reach out to them, because I get so excited whenever people reach out to me and ask me for guidance, and know that people are always willing to mentor. And then the one thing that surprised me, probably is, the ease of opportunities, right? And I always tell and remind everyone, it really is up to us, because the opportunities are there. So, it's up to us to really take advantage of them, because, as an early nurse, as I said, from the very beginning, I wanted to be as engaged as possible, always volunteered, for committees. What can I do to help? And I know that's not sometimes, the way. Some of, the nurses think, they think I'm going to finish my job, do the shift, and then, be done with it. But the more that you can actually engage and make yourself visible, the more opportunities come your way. And many of the, things that have come to me, people have actually noticed and tapped me in the shoulder and say, hey, I think you should consider going for this position. So just know that whatever it is that you're doing, people are seeing and recognizing.
And for me, I would say the same. As early as now, I'm sure you probably know a person or two, or even some of your relatives who are here now. So make sure that you start get connecting with them and talking to them, so that you will be more aware of what to expect when you transition here, and really due diligence in trying to research and learn more about, especially if you know where you're gonna be deployed, what state. It would help a lot if you start reading. And then also, there's a lot of resources that Worldwide provides. I know if you are having some issues or not as proficient with English, they provide English classes. And there's a lot of resources that are actually free, if you can just find, a place to Google them, and if you're willing to just learn and just be diligent about it. What really surprised me was that at first, when I first came here, I was so meek. I was so, like, really, I would say I was an introvert. I became an introvert. I usually am like a happy-go-lucky, but I was like that for some time. And so then what surprised me is that a lot of them are really like very nurturing people, like Christine mentioned. Then I got to, even in my first job here in the US, I got to have a lot of mentors. And it is up to us, like she was saying, and I totally agree, because there's a lot of opportunities if we're just willing to open that door and be intentional about it, and then work hard, dedication, and a lot of prayers.
Awesome. Well, again, thank you both so much. We appreciate your time this morning and the time that you took to prepare all of this. At Worldwide, we want to continue to partner with PNAA and other groups to help, as they mentioned, prepare you in your journey to the U.S. and when you arrive. So please make sure to like and follow our Facebook page so you can be aware of any events that we have coming up. And also, please see the link for the that's on the screen right now for the PNA NDC, so that you can also learn more about their program there as well. Thank you so much. We hope everyone has a good either evening or morning, depending on where you are in the world. And we look forward to talking with you again soon.
Thank you.
Yeah.